Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. We are continuing our family healthcare series with Hackensack Meridian Children's Health. Our guest today is Dr. Heather Appelbaum, Division Chief of Pediatric and Adolescent Gynecology at Hovnanian Children's Hospital at Jersey Shore Medical Center, which, along with Joseph M. Sanzari Children's Hospital, is ranked number 1 in the state by U.S. News and World Report. Our topic today is specialized pediatric gynecology services for children and adolescents that are available through Hackensack Meridian Children's Health. Welcome. Thank you for joining.
Thank you, Kate. So nice to be here.
Really interested to sit down and talk with you today because I learn something new every day, and just this, I guess, outside of the scope of what you don't know what you don't know. I had no idea that there was gynecological specialties for pediatrics. I had no idea. And my aunt is an OBGYN too. And I just said, I've never asked. I don't know. I thought that maybe, I know my stepdaughter's 18, so I know that she just made her first appointment to go to the gynecologist. And I kind of just thought that's what happened. But yeah, if you need gynecological services as a child, then there's a specialist for that, right?
Yeah, isn't that great? Most people have no idea that there is such thing as a pediatric gynecologist, so you're not alone.
Yeah.
But I think it's important to know, I'm also a mom, and I also live in Monmouth County, and if I needed medical services, I wouldn't want to know what things are available. So I appreciate you inviting me here to speak with you today. In terms of pediatric gynecology, it's a subspecialty that's really necessary because it's a niche of patients that really get a little bit lost when they have a gynecologic issue. Mm-hmm. Moms kind of flounder around and they go to their adult gynecologist who may not have a lot of experience with pediatrics, or they'll go to their pediatrician who really doesn't have an expertise in the area of reproductive health. So it's a very specialized field, and I'm so happy to be a part of it.
Yeah, that's great. Incredible. All right, first question. Many women have their first experience with a gynecologist when they're young adults, but there are some cases where young females may need gynecological care as children or adolescents. Tell us why families would seek you out, and in particular, one with unique surgical expertise such as yourself. So what are some circumstances?
Right. So you described your 18-year-old stepdaughter who went to the gynecologist. She probably went to your gynecologist, which is what people typically do when they're 18 years old. They're coming for reproductive health, contraceptive benefit, prevention of sexually transmitted infections. So I do a little bit of that, but really I have a more specialized practice. So girls will come to me when they have particular issues, generally at a younger age. I see children between the ages of 0 and actually I go all the way up to 100, so I see adults as well, and I transition children into adulthood. But it's typically people who have a particular problem. Mm-hmm. So something of the reproductive tract that presents in children. For instance, I'll tell you, I had a patient yesterday, actually, who came to the emergency room. She was 7 years old and had a bicycle accident and unfortunately sustained an injury to the genital area. Okay. And so that's a perfect example of why somebody would seek out my surgical specialty.
If you have a fall or something like that where you injure that part of your body.
Exactly. Okay, so we took care of that. Other circumstances why somebody would come is, let's say a girl has very severe painful periods. Mm-hmm. Painful periods is somewhat normal, but when it's outside the realm of normal and kids aren't able to go to school or they're missing regular activities, they're not able to do their after-school sports or attend family affairs or go on social events, this is when it extends outside the realm of normal. And girls really just need somewhere to turn to. And when they're 12 years old and first getting their period, going to an adult gynecologist may not be the right environment for them.
Right.
So we address those kinds of things. That's one example.
And outside of the realm of a pediatrician can, is not, doesn't necessarily know what to do. And,
exactly. Yeah. And then we have very specialized services where girls are born with abnormalities of the reproductive tract. So they're born with, let's say, birth defects where either they're missing a uterus, they're missing the vagina, they're having abnormal ovarian development. So that's where my surgical expertise really comes in and is a highly, highly specialized field.
Interesting.
So I do reconstructive surgery of the pelvic organs.
From a young age to then hopefully be able to have them be reproductive as an adult?
Yes, but also so that they can have adequate sexual functioning when they reach the stage, and then for promotion of reproductive health and be able to promote their future fertility, and so that they can function as normal girls going forward.
Interesting. Do you handle any when children have any type of precocious puberty and like precocious andronorrhea? Yeah.
Right.
So you work with an endocrinologist?
So I work with an endocrinologist, but I actually do all of that stuff myself also. So when girls develop periods early or have bleeding at a young age, they'll come to see me. And there's lots of reasons why girls will have bleeding at a young age. It's not just precocious puberty, and that's sort of my job to sort out what's happening.
Interesting. Okay. What are some of these specialized surgical services that you provide? We kind of covered that just now, but as a pediatric gynecologist. So.
We covered a little bit of it, but actually there's a lot of things I do besides genital trauma, right?
Okay.
We talked about that. But minimally invasive surgery for ovarian cysts in children, endometriosis, tumors, masses of the ovaries or the reproductive organs, the pelvic reconstructive surgery. And we also have a relatively new specialty that I'm engaging in, which is ovarian preservation for girls who are undergoing cancer treatments.
Oh.
So we're able to harvest the ovaries and freeze them for future use. So we take them out prior to the girls having cancer treatments that may affect their fertility, preserve the ovarian tissue, and then re-implant it when they're done with their cancer treatments just to preserve so that they can go forward and have children.
Wow, you're amazing.
It's pretty amazing.
You're really cool. This is amazing.
And sometimes we move the ovaries out of this field of radiation. So there's a lot of things that we can do to preserve fertility for kids who are undergoing cancer treatments.
Wow, incredible. Okay, one of the conditions you treat in adolescents and young adult women through a special program at Hackensack Meridian Children's Health is polycystic ovarian syndrome, PCOS. I am semi-familiar with PCOS. I have a few friends I know that have struggled with it over the years, and I think we're diagnosed as teens and struggled with with their weight and extreme periods and really then going into their young adult life struggling with fertility. So what is PCOS exactly? And I know it affects a large number of women, correct?
It's about 10% of the population.
Okay.
Polycystic ovaries PCOS, polycystic ovarian syndrome, is a constellation of symptoms that come together to cause irregular periods. And really it's associated with elevated ovarian hormones that are abnormal, so androgens specifically. And those androgens can cause menstrual irregularity, but they also can cause some of the symptoms that you talked about, overweight. Sometimes people have excessive acne. They can have hair growth in places where they don't prefer it to be growing, particularly on the face and neck and that sort of thing. And then it's also associated with metabolic disorders. So it puts patients at increased risk of type 2 diabetes, metabolic syndrome, being overweight, obesity, really struggling with their weight. So it's a combination of things that really affects the metabolic overall health of the patient, but also can affect future fertility because the girls are not getting regular periods, they're not ovulating on a regular basis, and if you're not ovulating on a regular basis, that compromises the ability to get pregnant.
How is it diagnosed?
So it's diagnosed first by discussing with the patients and finding out what their history is, their menstrual cycle history is, and the frequency with which they're having periods, and then a clinical examination. Take a look and see distribution of acne, if there is any distribution of the hair growth on the body, both on the face, the chest area, but also in the genital area as well, and blood work.
And blood work, and that tests hormone levels.
And also the metabolic milieu of the patient. So we're looking for insulin levels and sugar levels, and also making sure that there isn't something else that's causing the abnormal periods and some of the symptoms that are presenting. So we have to make sure that there is no other hormonal imbalance, or there is no, let's say, tumor that's secreting androgens and making it look as if there's an elevated androgenic situation that's coming from the ovaries, but there's an external source.
Interesting. Okay. So I just asked this PCOS. How is it diagnosed and treated through the multidisciplinary program at Hovnanian Children's Health?
Yeah, so I can tell you a little bit about that.
Okay.
Actually, we just talked about diagnosis, but treatment's a whole different thing, right? So we have a multidisciplinary program at the Children's Hospital that is comprised of pediatric gynecology, which is myself, and pediatric endocrinology, as well as we have a nutritionist that we work with very closely. So the treatment really is multifactorial. We really approach it from all different angles. So we regulate the cycles sometimes with hormonal therapy, but we also really work on the cosmetic things like the acne and the excess hair growth by balancing out those hormones. And then by addressing the metabolic situation, we really work on changing lifestyle, proper eating habits, regular cardiovascular exercise. Those kinds of things are really promoted, and sometimes we have to use medications to balance out the insulin levels and avoid type 2 diabetes.
Oh, interesting. Wow. So some of the providers that will help within this program are at the Hope Tower.
So we actually all come together, and we're in my office, which is down the street from here in Oakhurst.
Oh.
Or down 2 streets.
Okay.
And so we're actually, it's not just a virtual together multidisciplinary program, we're actually physically together.
Okay.
So the endocrinologist and myself will see the patients together with their caregiver. We'll examine the patient together and review the blood work together and make a treatment plan together.
Wow, that's incredible. Okay, you mentioned irregular periods. What are painful periods? I have always been very lucky. I will say, I didn't. My friends would always complain about bad cramps and stuff, and I'm like, I just had a very regular cycle until now, where I just turned 40, and I feel like I'm starting to get this perimenopausal wave that now you see so many women talking about and sharing about on social media, and you don't want to talk to me 3 days before. I become a totally different person. I don't know why. So what determines someone that would really need to be treated for painful periods? I know a friend of mine too, actually, who has PCOS. When we were in high school, she would have to actually miss school when she had her period, just because it was so painful, and she just couldn't get out of bed. So how common is that? Is that something that happens to a lot of young girls, and does it get better?
Right, Kate, so you're bringing up a lot of things, a lot of interesting topics. The first thing you brought up is being, approaching menopause. Well, it's interesting because adolescents are kind of on the other end of the spectrum, so they have some of the same symptoms. So as you approach menopause, and for the moms who are listening, right, the hormones start to fluctuate, and then we start to get more moody, and our periods start to get more irregular, and we might even get more discomfort, more breast discomfort. Well, the kids are experiencing the same thing as they enter into their reproductive years, as they start getting their periods. So some of these symptoms may be completely normal. Irregular periods, pain with the periods, it's a little heavier than, let's say, it would be when you're in your 20s and your 30s. And that's generally pretty normal. PMS, having all those symptoms, pretty normal. But when we get outside the realm of normal, like I mentioned before, where a girl isn't able to participate in school, she's missing school, she's not able to participate in normal activities, then we need to dive a little bit further and dig a little bit further. But just taking Advil and Motrin may help the situation, but sometimes it's not enough. I had a girl in my office yesterday, in fact, who literally was punching the walls with her discomfort when she gets her periods. And she's 12 years old, and she's had 2 periods, but each one has been a nightmare for her and a nightmare for her
mother.
Yes, and everybody in the family. It's really drastic. So that requires, a kind of a deeper dive. Yeah. What's going on? Why is it so horrible? So is it that she's just experiencing horrible periods and just has a lower, threshold of pain? That could be. But we also have to make sure that she doesn't have some sort of structural defect like an ovarian cyst, or even obstruction to her menstrual blood flow that's causing the discomfort, or maybe even something called endometriosis that you just brought up. Endometriosis is something that causes horrible pain with periods. It's totally different than PCOS.
Yeah, right.
PCOS is more of the frequency of the period, and then some of those, physical signs, and then the risk of diabetes and the risk of glucose intolerance and things like that, really struggling with weight, that kind of thing, and may cause problems with fertility. Endometriosis is totally different. PCOS really isn't even associated with pain. we think it is because we think it's related to ovarian cysts, but really it's a misnomer. The polycystic ovaries was actually originally described by somebody as multiple different cysts on the ovaries. So people think it's like, oh, I have ovarian cysts, but really those little tiny cysts are just little tiny eggs that are follicles, and they're cystic in nature, and they produce hormones. So it's not really an ovarian cyst type of syndrome. It's really more of a hormonal syndrome. That's PCOS.
And it can affect your fertility and just cause multiple problems throughout your adulthood.
Right, and one of which is actually not pain. But people get really confused because they think they hear cysts and they're like, that has to be painful.
Yeah.
But it's not. It's different than having a cyst on the ovary. It's more of a hormonal situation, whereas endometriosis is actually super duper painful.
Yeah.
Can be associated with cysts, but generally is not. It's really more associated with bleeding in the pelvis that comes from little cells that are supposed to be inside the uterine cavity, and they're found throughout the pelvis. And when the girl gets her period, she gets her menstrual blood flow, but there's all this teeny tiny microscopic bleeding that happens internally when she gets her period.
Interesting.
And blood is painful.
Yeah.
Especially when it's places where it doesn't belong.
Right. Oh, that's interesting. Okay. What percentage of are girls getting their periods younger? Is that a statistic?
I don't think so.
Okay.
I think people just think it is.
Because of social media, because you hear more things, you're able to hear stories more prevalently now. People are a bit more open about talking about it than I know when I was a kid. So I've thought about that too. It's are we just talking about it more, or is it actually happening? Because girls that, oh, she got her period when she was 9. I don't know. Is that really actually happening where girls are younger getting their periods?
So the normal age of the onset of the first period, there's actually a really broad range. So it can go from 9 to 15 and still considered to be normal.
Yeah.
So 9 is definitely on one end of the spectrum, but so is 15. But anything in between there is considered to be normal. What we have seen is some trends with obesity, right?
Yep.
So with the growing population of obese young people, then they tend to get their period earlier.
Okay.
So it's a trend that's kind of associated, but I think overall the age range hasn't really changed.
Okay. Do you see more of an uptick of diagnosis of precocious puberty and andronarchy?
No, not really.
Not really. Okay.
Precocious puberty is really defined as getting the period before the age of 9, even maybe before the age of 8 in the African American population.
Okay.
So girls can get their period super duper young.
Yeah.
It's just when that first girl in the class gets her period, she's an outlier, right? And it gets everybody concerned. How when is my daughter going to get her first period?
Right. Oh, that's so true. Yes. Okay. What should we be aware of with our teens and preteens when it comes to your daughter saying my period really hurts, and you described your patient that's really going through something that seemed a bit more extreme? What would be a situation where we would really need to seek more accelerated treatment?
Yeah, I think if something seems abnormal, that's the time to seek treatment. And I think that's the benefit of having a pediatric gynecologist, that there is somebody to talk to.
Yeah.
And to check it out, because most of the time things are pretty normal. There's a huge range of what's considered to be normal. But when it's not normal, you have to know where to turn.
Yeah. Yeah, that's true. Okay, if your daughter doesn't have any kind of issue as a child, what is the current guidance for when she should start seeing a gyno, and what should she expect?
Yeah, so we generally we generally recommend that kids should come somewhere between the age of 13 and 15.
Okay.
But I always tell moms that if you have any question, there's lots of things that I can help you with in terms of promoting health for young girls. So some moms are really comfortable talking to their girls about puberty, and some moms really just don't feel comfortable with that. So I can do that. I can introduce to a girl that your body's going to go through changes and some of the things to expect at that time. And sometimes girls go through puberty and they really just struggle with the symptoms, either the PMS symptoms, the pain that's associated with the hygiene, even things that I talk about. So these are health maintenance gynecological things that I can talk about with young girls. And then sometimes people start their gynecologic care because they actually have an issue. But if you don't have an issue at all and everything is perfectly normal, establishing a relationship with the gynecologist at a young age is really important, because you don't want the first time you go to the gynecologist to be when you have a horrible problem.
Yeah.
That's devastating.
Right.
And coming to the gynecologist is, before you even get started with whatever the issue is and whatever the problem is, it's fraught with a lot of anxiety, the fear of the unknown, what's going to happen. It's somewhat invasive, right? Even though we don't do internal examinations on young girls, looking at their private parts can be very uncomfortable.
Oh, you don't do like pap smears and stuff at 18?
No. Pap smears start at the age of 21, according to the American College of Obstetrics and Gynecology. So we follow those guidelines.
Got it. Okay.
And I only do internal examinations on girls that are already sexually active. So the young girls that come in, we sometimes will look externally. That can be very informative, but we don't put anything inside young girls.
Okay. But recommended annually at 21?
Pap smear is recommended every 3 years at the age of 21, and then over the age of 30 every 5 years. Recommendations have changed over the years.
Oh, I didn't know that.
Yeah, it's associated with the HPV vaccine, right? So some people are getting their HPV vaccine, they're at less risk of cervical cancer. And also we found that frequent testing in the young population just leads to too many invasive procedures. So we space it out a little bit. And we have shown that it actually hasn't affected the long-term risk of cervical cancer.
Okay.
So our screening techniques still work.
Interesting. I've been going every year.
You should go every year. Absolutely go every year to the gynecologist. Very important because we have a lot of body parts.
It's the one thing I do that's like every year. Right. Dr. Patel is like, hey. Like,
you definitely have to go every year because there's a lot of body parts besides the cervix. So the pap smear is really actually checking the cells of the cervix for abnormality.
Okay.
And when you go to the gynecologist, and when a young girl goes to the gynecologist, we're checking all the female reproductive organs. That includes the breasts. We're also doing an abdominal exam and a pelvic exam, checking the external genitalia internally for women who are sexually active or adults and moms in the audience, right? Yeah. We're checking the bowel, the bladder, the uterus, the ovaries, the vagina, fallopian tubes. So there's a lot there besides the cervix. So your pap smear is once every 3 to 5 years, depending on your age. But the whole thing needs to be checked on a yearly basis.
Every year, okay.
It's kind of like not the place you can see, right?
And your mammograms after, is it 40 now? Right?
Yes.
40 still? Yep. I feel like they're starting, women go earlier now, but
if they're high risk.
I just started going last year. I got to make the appointment for this month. Can we touch real quick on perimenopause?
Yeah, why not?
Okay. So I mentioned it earlier. Do you go to a gynecologist when you're having menopausal symptoms?
Sure.
Okay.
I think we do.
I have not even really ever brought that up with my gyno,
because you're young.
Because I'm young. However, like I have friends now that like are in their mid 40s and are like having symptoms and are on hormones. And I've noticed too that like I just like things are shifting like a little bit. Like I mentioned, like just like period symptoms, or like I get like really hot like in the middle of the night occasionally. Yes, like just be like much more irritable. But there are, I know like when I was a kid, I think that the perception about hormones was like that they cause cancer. So I know that we've talked about on the podcast a little bit with some of the other providers that have come on. But now it's kind of swung back where like, you know, they are advised to help, you know, combat a lot of the symptoms that you have. Is a gynecologist the best person to see when you are going through menopause, especially if it's like, you know, you're really struggling with it? And like, what do you recommend when moms in their 40s like start having symptoms?
Right. I think all moms should be, all women should be educated by their gynecologist. I think it's one of our jobs to promote health care, is to educate our patients on what to expect as they approach the end of their reproductive years. And I think that's starting in the 40s. You know, average for most people, the age of menopause is 50. But I think that's a perfect time at the annual visit to talk about some of the symptoms that you mentioned. The night starts with night sweats, maybe turns into daytime hot flashes. There's women struggle with their weight, they struggle with their moods, their libido changes as we approach menopause. And I think when women know what to expect, they kind of approach it with a little bit more ease and grace, right? And that it's a normal occurrence, right? It's a normal life stage that women enter. So if they're educated, they know what to expect. Sometimes it requires hormonal therapy and sometimes it doesn't. And we really should be, as a gynecologic community, educating our patients and then making individualized treatment plans.
Yeah. It's so important, and I think something that, you know, was a little bit more taboo to talk about, but now, like, you know, you just hear so many more women talking about openly, like, experiences that they're having, and who to go to. I think has been like very challenging for a lot of women too. You know, I know I've always gone to a male gynecologist, and, you know, I had both of my children with him, and he's great. But I think, like, as I get a little bit older, like, maybe, you know, I've thought like going to a woman where I can just kind of, you know, talk about like symptoms that I'm having would probably be like better for me. But I hadn't like really thought about like what, who you go to, or like how it's treated and what hormones are right for you, if you need hormones at all. Like, I don't really know anything about it.
I think a lot of moms in your age group struggle with that also, because they know their obstetrician very well and have a very close relationship with them.
But it's like a different thing.
Babies. But as you enter that other stage where you're no longer really interested in your fertility, but you're really interested in your own health and being really, aware, you wonder whether your obstetrician can make that transition with you. And most obstetricians can, because we're trained as in obstetrics and gynecology.
Right.
But there are people who really specialize in that transition of life, stage. People who particularly do gynecology, just like me, that, one day, I used to deliver babies, but we know that our patient population ages, and so just delivering babies isn't all that's necessary for an OBGYN.
Right. No, it's very broad.
Some of us have just specialized in gynecology. So, back in the day when I delivered babies, I loved doing that. But as my patient population, ages, and I have found this niche of pediatrics where I know that there aren't a lot of people who can have the expertise and understanding of what that patient population needs. I've just not, I've stopped delivering babies, but I'm still super duper busy with the young people and with the perimenopausal women.
Interesting. Wow. Well, thank you so much. This is a lot of great nuggets of information. What do you want families to keep in mind when they come to see you or your team?
Okay, well, that's a great question. And there's a lot that I could say about that, but I think I have to start in the beginning. And the first thing that I think I would want to tell all the moms is don't panic. We know this is your child's first experience. We are very sensitive to that. I have a beautiful, compassionate team of healthcare providers and nurses and my front staff who really understand that this first experience needs to be something that's calming, that should set off their reproductive years in a positive direction. We're very much focused on positive body image and privacy and self-advocacy for protection to prevent any unwanted touch that's inappropriate. And that's the basis. And I want the moms to know that we work very hard in trying to make it a comfortable experience, because we know the first is the one that sets girls off on a trajectory. Right? We don't want them to panic every time they go to the gynecologist, and we want to develop a positive relationship. So that's the first thing. And beyond that, I don't know what else I could tell you.
I mean, I could imagine that. It's it's not the same as going to a pediatrician, right? So your child might feel like a little uneasy, and the parent too. But it sounds like it's a really welcoming environment, and you treat so many different things, and I'm sure that they're in good hands and get the best care. Where can everyone find you and make an appointment?
Okay, well, thanks for asking. So my office is in Oakhurst. It's 1900 Route 35 in Oakhurst, and I guess, can you post the phone number?
So we're gonna put all of the contact information in the text, so they can easily find the website and schedule an appointment or ask any questions with you. So.
Great, and also they can go through their pediatrician. So if they, if they're having, I happen to be very busy, so if they call the appointment line and they don't get a timely appointment and something feels like it's urgent, their pediatrician can call, and based on the urgency of the visit, we can see people same day if we really need to, and if it can wait, we make it wait. We kind of figure that out based on the urgency of the issue. So don't fret if you call the office and there's a long wait. If there really is something significant, a girl has a ovarian cyst, or she's having something that's more urgent, like a vaginitis. They can't wait. You can't wait 6 months when you have a vaginitis. You can't wait 6 months if you have an ovarian cyst. You can't wait 6 months if you have an obstruction to the period. So just call your pediatrician. The pediatrician can call, and we can sort out the right timing of the visit.
Oh, wow. Okay. Good to know.
Okay.
Thank you, Dr. Appelbaum. This has been really informative, and I'm sure lots of moms will benefit from hearing all of the incredible resources and services that your practice offers. And thank you to Hackensack Meridian Children's Health for continuing to spread awareness about everything that's happening within your system.
It's super nice to meet you. I'm so honored to be here. Thank you so much.
Thank you.